Hello everyone, Dr. Sam Schroetke here, Physical Therapy and Hand Clinic of Hillsboro, and we are coming back at you with Technique Tuesday, and we're doing a series of videos for the core musculature, okay? And we're breaking up the core into regions, so there's an anterior portion, which we demonstrated with the McGill curl-up. There's the lateral region, which we've already done with the side plank and modified side plank, and then we're going to show you another lateral or side core exercise called the Pallof Press. And then for the back part, we've done the bird dog variations, okay? So this is called a Pallof Press. My guess is that it's named after some guy named Pallof, and it probably was Russian or something like that. All the good exercises tend to come out of like the Eastern Bloc Europe. So what you do with this one is you're going to anchor the band in the door, and you're going to do it at about your chest height, okay? So I know you know how to do this, but I've got to do it for myself. All right, here we go. Okay, you can use tubing. If you were at a gym, you could use the cables, okay, or some kind of band. But what I like to do, and the way I've seen it done most times, is you grab the bands with a pistol grip, okay? So you could do it like this. I don't think that it matters, but this is the way I've always done it. So pistol grip. I'm going to come away from the door a little bit to make tension in there. You have this at your midline. To start, I would put your feet maybe about as wide as shoulder width apart, maybe a little wider, okay? And you're holding it right here at midline. Watch with your back, I guess. You don't want to be in this kind of lousy slouch position. So kind of be upright. And then what I'm going to do is just extend both my arms. So as I do this, I feel that band wanting to turn me, but I'm using my core to prevent the rotation. Okay, so this is an anti-rotation exercise. We're using the core to stabilize, to prevent movement. All right, so here I go. Pistol grip, and brace the core. So again, I'm acting like somebody's going to punch me, and I brace my stomach, and I push straight out. I'm going to hold for 6 to 10 seconds, and then I'm going to bring back. Okay, again, extend those arms straight as you can. Hold 6 to 10 seconds, and then back. And you're going to do this, build up to 10 to 15 reps. This is engaging the side that's closest to the wall or the door. So you're going to have to do this on both sides. Okay, Pallof Press. I guess on this one, the two most common things I see, some people just do this, and I want you to engage that core. I want you to feel the muscles engage. So hold it out there, pause a bit, 6 to 10 seconds. All right. The other thing is sometimes when people do this, I'll see them go like that, and that can, then you're running the risk of maybe affecting your back in a bad way. Okay, so you want to keep upright. Don't lean forward when you do this. So have your hips stacked right over your heels, okay, or over your feet. All right. Pallof Press, 6 to 10 seconds, 10 to 15 reps. The farther out I go, the stronger the band's going to be. So I wouldn't start out that far. Okay, you want to feel it initially so that you're working, and then over time, either add repetition or walk further away. Okay, so that's your Pallof Press. I like that one. It's a good one. Okay. In fact, I've noticed with treating some people when their backs are getting healthier, and we might start, I've seen this happen a couple times, we start doing the side plank, even the modified version, and it throws them off again. So sometimes this is a better alternative actually before the side bridge, is starting with the Pallof Press. Okay, but careful of this one. All right. I'm Dr. Sam Schroetke here, Physical Therapy and Hand Clinic of Hillsboro with Technique Tuesday, the core edition. Like us on Facebook, like our YouTube channel, and ask questions, make comments, and we will get back to you. And I feel like my forehead's getting larger. All right. Thank you very much.